Fall prevention. This elderly nursing home resident is and quality of life. While doing this, the facility must also ensure their safety with a fall prevention program that also addresses a resident's individualized needs. As a nurse aide, you play an important role in helping to prevent falls, while also assisting residents with their freedom of movement and mobility. The purpose of this program is the following. First, to provide you with a general understanding of why some residents are at a higher risk for falls. Second, to describe actions you can take to help prevent falls. We will review the following topics: factors contributing to falls, helping to prevent falls, special concerns with the use of restraints, and recognizing and reporting changes in a resident's mental or physical condition. At the end of this program, you should be able to describe at least 3 factors that place a resident at risk for falls, describe 3 actions that you can take to help prevent a resident from falling, and give an example of how the use of restraints may increase the risk of a resident's falling. Falls can often be prevented. To reduce the risk of falls, facilities must have a fall prevention program. This program should include identifying who's at risk for falls, determining the possible causes of falls, developing a care plan that gives instructions on what actions are needed to prevent the resident from falling, and ongoing assessment to evaluate those changes in a resident's mental and physical condition that may place him or her at a higher risk for falls. The resident's care plan will tell you as a nurse aide what actions you need to take in order to prevent falls while providing daily care. It is important to remember that if a resident has fallen once before, then that places him or her at a higher risk for falling again. Factors contributing to falls. In order to understand why some residents are at a higher risk for falls, it is important to review some of the physical and mental factors that contribute to their condition. Physical factors include problems with gait and balance, poor mobility, such as difficulty moving between a bed and a chair, poor vision and hearing, previous physical injuries or falls, diseases such as arthritis, heart disease, stroke, or diabetes, poor food and fluid intake, and the use of some medications. Mental factors that may contribute to falls include depression, fear and anxiety, and dementia, such as Alzheimer's disease. Dementia is a brain disorder involving the loss of memory and thinking abilities as well as physical functioning. An estimated 50% of nursing home residents suffer from some form of dementia. As dementia progresses, residents become physically weaker and less coordinated. This leads to a decline in mobility. Confusion often adds to the problem. Activities of daily living become more difficult to perform, and there's a greater chance of falls, accidents, or injuries. Resident's care plan should tell you what physical and mental factors place the resident at risk for falls. Another very important factor that can contribute to falls is the resident's environment or living space. For a frail elderly resident who has difficulty walking and has poor vision, the environment may be filled with potential hazards that could cause a fall. Examples of these hazards include slippery floors, loose rugs, cluttered pathways, or uneven walking surfaces. Preventing falls requires that you, as a nurse aide, pay close attention to a variety of details, such as loose-fitting shoes, slippers with poor tread, clothing that may interfere with walking, loose or broken brakes on a wheelchair, or a walker that's not the proper height for the resident. Consider, for example, a nurse aide who discovered that one of the locks on a resident's wheelchair was not working. She quickly called maintenance to have it fixed. Residents who are at risk for falling can lose their balance, slip, or stumble from several positions: standing or walking, getting in and out of a chair or wheelchair, getting in or out of the bed, and getting on and off the toilet. To help prevent falls from these positions, a resident's care plan may require a number of preventive measures to help ensure his or her safety. Here are some examples that you should be familiar with. A lowered bed. The purpose of a bed that's positioned lower to the floor is to reduce the risk of a resident falling while getting in and out of bed. A call bell. A resident can use a call bell to ring for assistance. A call bell must always be placed within easy reach. You should make sure that a resident knows how to use the call bell. Special lifting devices. Special lifting devices may be used to help transfer and transport a resident between the bed and chair and to and from the toilet. Training is required in order to use these devices properly and safely. An alarm device such as an electronic motion sensor. An electronic motion sensor in a resident's room can be used to alert you when a resident is getting out of bed unassisted. Alarm devices are often used to monitor the actions of residents who are at a higher risk for injuring themselves, such as individuals with dementia. A reaching device. For residents who are able to use one, a reaching device like this can help prevent falls by allowing them to reach for personal belongings without getting up or bending down. A gait belt. The use of a gait belt is a simple way of assisting residents who are at high risk for falls. A gait belt can be used to assist an individual in walking or for transferring a resident between a bed and chair. It can help you in lifting a resident and providing him or her with support. If a resident begins to fall, the gait belt will help you stabilize and support the individual so that injury can be prevented. Helping to prevent falls. In the following section, we will give examples of how you can assist residents in order to help prevent them from falling. The types of assistance we will describe may also be the types that are required in a resident's care plan. It is important to know that residents are often at greatest risk for falls